Good evening, everyone. Welcome to The Healthier You with Wendy, a guide to living a healthy, active, and productive life. Tonight, we're going to talk about the new Affordable Care Act. I have a very special guest here with us, John Gonzales, Center for Health Reporting here in California. John, welcome.
Thank you.
Thank you so much for coming on to the show.
Thank you. I'm happy to be here.
What is Affordable Care Act? How does that impact Californians?
Well, I guess a good place to start would be to try to kind of cut through some of the misperceptions of it and define it. The Affordable Care Act is the same as ObamaCare, and it's the same as health reform. All three things are the same thing.
Okay.
Sometimes folks actually think they're three different things, and that's probably the fault of people like me, reporters who haven't done a very good job of defining it for people. So all three of them are the same thing. The Affordable Care Act is what I'll call it, because it's a law that Congress passed to essentially establish a health system that will help the 5.3 million, I think, or actually 5.6 million folks in the state who don't have health insurance right now. It does this two ways. One way is it establishes exchanges, insurance exchanges. Some of you might know it as Covered California out there. And also expands Medi-Cal, which is the same as Medicare, just in California we call it Medi-Cal. So that's the two ways they're going to do it.
Okay. What is the timeline for Affordable Care Act?
Well, you know, it's essentially began. You can start enrolling now. You know, there are some complications that go with that because it's such a huge expansion.
Right.
But it's essentially began, and by the beginning of next year, you would be officially kind of participating in it if all goes according to plan. You'd start seeing doctors and you'd start, you know, availing yourself of that new insurance.
So let's say I'm a resident here in El Monte or here in Southern California. Walk me through the process, if you would.
Okay, so the state says that what you can do essentially is give them a call. Numbers, I think if you just go online and you search Covered California, there'll be a telephone number there for you to call, and you can call and initiate your enrollment that way. Or on the Covered California website, there is a enrollment portal where you actually begin your enrollment, and you type in who you are and you know, things that determine whether or not you qualify, like your income, whether you're in the country legally or not, that type of thing. And that's how you get started. They are supposed to follow up with you, of course, and finalize your enrollment. And you do things like pick a plan, which health plan you want, that type of stuff, if you're in the exchanges. If you're in Medi-Cal, you're going to be part of the Medi-Cal system.
Okay, so sort of let me put it in very simple words. So what I could do is call them or go on to coveredcalifornia.com and to look at my eligibility and to essentially go on to that exchange platform, that website, to look up what type of insurance that I would be able to buy through that exchange. And they offer different levels of health insurance exchange, bronze or platinum plans, and etc. Right? And if my income is it's lower than a certain percentage FPL, then I might qualify for the expanded Medi-Cal. Or if my income, my household income is above a certain level, then there might be subsidies that will help me to purchase that insurance plan. Is that correct?
That's the way it works, exactly. Yeah, that's exactly how it works.
A lot of families out there will be questioning, you know, is this really a good thing for individuals, for different families?
Well, you know, that's a big part of what my job as a journalist is to try to determine whether or not this is going to be a good thing for the public. So far in my reporting, and I'll speak in that context because I can't really take a position myself, but just by reporting and talking to people and talking to officials, I'd say that at the beginning there are going to be a lot of frustrations with the enrollment. There are going to be some frustrations with waits to see your doctor under this new system. It's going to be, I believe, a bit of a rocky road to begin.
What do you mean by wait to see a doctor?
Well, I mean, anybody who has, I have health insurance now
Right.
through USC, which is my employer, essentially, right?
Right.
And I have to wait. I actually
Okay.
made an appointment this week, and I'm going to have to wait 3 weeks till I actually see the
Okay.
doctor I need to see.
Oh.
I have private employer-based insurance,
Okay.
so I have to wait that amount of time with that type of advantage. When we're talking about the Medi-Cal system, or an entirely kind of new batch of folks who are being insured, you can imagine the waits are going to probably be longer than my waits.
Right.
So, so there's going to be that. There's going to be working out the kinks.
So you know, in that case, for individuals who already have employer-sponsored insurance, health insurance, does the new Affordable Care Act impact their health insurance policy?
You know, if you talk to some politicians who are in favor of health reform, they would tell you, no, it's not going to affect you at all, right? That's what they would say. And that's pretty much true in terms of it's not going to cause you to have to disenroll from your insurance.
Right.
You know, that won't happen except in very extreme cases. But what it will do is it will make it so that everybody is insured in the same system.
Okay.
So the gold plan, the bronze plan,
Right.
those plans, those are all made up of insurers that exist today.
Right.
Right? One of them might be your insurer that you have
Okay.
through your private insurance. So you're going to be in line with those folks that are
Okay.
newly enrolled, waiting for your doctor. So I think it does impact you that way.
So it sounds like the new Affordable Care Act will provide coverage on an option for small business owners or employees who work in small businesses, restaurants, construction companies, or university students who are uninsured, 18 to 25, and et cetera. So
Yeah.
so in that sense, it will provide these individuals with that additional I guess additional option to
And
for health care.
where it's a good thing. That's
I
where, as a reporter, I would say it's a good thing.
Right now,
Is that-
you know, it's great that we have, you know, we are providing health care for these individuals. What do you see are some of the challenges on the ground for the implementation of
Well,
Cover California?
One reason I say it's a good thing too is to kind of backtrack a little bit and think about where we are now with having a bunch of people who aren't insured, right? That's not really sustainable. We can't stay that way if we want to remain a
Right.
fiscally healthy country.
Right.
It's just because it's destroying families to have, when they can't pay their bill and they're uninsured, they can't pay a
Right.
doctor's bill. It's causing people to go bankrupt. It's something that we just can't sustain as a society, in my opinion. You know,
Right.
as somebody who's researched it and written about it. So we need to, I think, probably start from there. That we can't do nothing.
Right.
Right. So what we've chosen to do is take all of these folks who are uninsured now and give them an option.
I see.
For those of them that are very low income, you know, they're not going to have to. They do have to pay to a certain extent, but they're not going to have to pay huge. You know, they're not going to have to pay for the health insurance because
I
they simply
see.
can't afford it.
Right.
For those that do make a little bit of money and earn a decent living or are working class, they will have to pay according to this sliding scale and the exchanges. But by and large, judging for the number of people who have called the Covered California,
Right.
have called Covered California so far, like almost I think 1 million,
Right.
people are interested. They think that it's a fair deal. So I think, you know, to kind of look at it that way, you think, okay, we can't sustain millions of people uninsured. We're establishing a new system where we'll insure a good chunk of those people.
Right.
And that's kind of square one. So that's why I think that's why I can say kind of with a clear conscience as a reporter that it's a good thing.
Right. You know, I think like it's a good thing that we're going towards, you know, in a sense, universal coverage, more comprehensive coverage for every citizen. And progress takes time. Change takes time. And I think at least we know that it's going to be a challenging path, but we're making progress one step at a time towards. So now, you know, just to before we wrap up, what do you think is the future of Affordable Care Act?
I think the future probably in 5 years, if you look at it that way, there's still going to be ironing out kinks. And I'm still going to be writing, and you're going to still be interviewing people who are talking about those kinks. I think there's a good chance, 10, 15, 20 years from now, that it's a fairly functional system that has done its job. I think there's a good chance.
So we'll be moving towards the Canadian-style, British-style universal healthcare system.
I don't know if politically that would ever happen, but I think we might be moving to a system where we'd be seeing fewer families ruined by medical bankruptcy. We'd be seeing people getting the healthcare that they need for their quality of life more often. And I think we'd be seeing, by and large, a healthier society. At least if the law does its job as it's intended, I think that's what we'd see years from now.
I see. Right. Oh, I mean, thank you so much for a very comprehensive overview of the Affordable Care Act, and now I'm finally clear that the ObamaCare is the same as the Affordable Care Act, same as the ACA, and it's the same as healthcare reform. So for those of you watching out there, go on to covercalifornia.com, look up your eligibility, and pick up the phone and give them a call and ask them as many questions as you like. Again, thank you, John, for being here.
Oh, thank you for having me.
Welcome back, everybody, to The Healthier You with Wendy. Our next guest is Bryan Kim of Kaiser Permanente. Welcome. Thank you for being on the show.
Thank you so much for the opportunity. I appreciate that.
So that's talking about Affordable Care Act, and you're from Kaiser. What does Kaiser do, and what is the connection between Kaiser model and the Affordable Care Act?
Well, the Kaiser organization, it represents three different segments, basically. Number one, you have the hospitals, where people would go into to get a lot of the procedures done. The second would be the health plan insurance side. And the third would be more essentially the medical office side, where they do a lot of the clinical outcomes, a lot of decision making. And so, as an organization, they've been well prepared for the Affordable Care Act, because that's going to have a direct impact from the health insurance side, as well as a lot of people that didn't have insurance that are now going to get a lot of coverage once they go to the hospital. So I think that there is one transformative measure that the company has gone through over the past 4 years, 6 years, is they revamped their healthcare system.
Oh, okay.
And so they essentially had multiple legacy systems that had all the disparate data, but the data wouldn't be able to talk to each other.
I see.
So they essentially centralized, standardized, got into an online platform where they can have a lot of that data in one location, so they can make better sense of that data and base key decisions on the future of how things should be done. So that was a good move on Kaiser's part.
Yeah, that's a very smart move. How does Affordable Care Act impact Kaiser, in terms of cost, in terms of delivery of services?
Well, a lot of the people it would have a twofold effect. One would be essentially people that have coverage currently. They would not need to make any changes at all. Okay. So if they have a current doctor or plan, they don't need to make any changes. They can keep it as is. The big changes with the ACA, or otherwise known as the Affordable Health Care Act, or the ObamaCare, is that you're having now people that didn't have coverage, over 45 million people in the U.S., essentially, that didn't have coverage, now are going to have the option of getting coverage at a discounted price. So with that option there, this basically is going to increase the number of memberships, the various options, the number of doctor visits, and the amount of data that's going to be expected to maintain. All those new members, that's going to be optional. That's going to be maintaining and coming on board.
Earlier, we talked about how technology, has impacted the delivery of care system quite a bit over the course of past couple of decades. And can you expand a little bit more and talk about the technology, integration of technology into the healthcare system?
Sure. I think just as a whole, one of the challenges, you'd say that the healthcare industry's probably had more of a latency of adopting new technology, because everything is so latent. A lot of the old systems, if you will, that they've been adopting, they haven't really revamped and modernized. So one of the big challenges is really having all the data that you would really need to make sense of. The second part of it is essentially having a platform where you can have all that data in one cohesive manner, so that you can make sense of that and determine future decision making to make sense of all that data. What does that mean? What kind of patterns can be emerged from that? And so any company that would like to essentially they'd be in a strategic advantage if they were to take all that data, adopt technology, and to help use that data to help drive future decisions.
Right.
And I think that's one of the areas too, is that they call that big data, essentially. It's transforming all that data to determine what's going to be happening and making a lot of future predictive analytics or forecasting based on that data. And so, just from my experience working at Kaiser, we'd say the approach there is really just to think more of preventive and proactive.
Okay.
So not wait till a patient gets sick,
Right.
but more of
But
take care of them
you
while
will
they're
still
healthy.
take care of them, right?
Yes, and if they get sick, then there's a plethora of resources
Right.
available as well.
Oh,
But the idea is really just to take a proactive, preventive approach to helping them to stay on top of things so that they actually would know when they come in so that they can maintain a good, healthy life while they're healthy before they get sick, while they're young, so that way they have better quality care for themselves, overall better well-being, and then thus lowering down the costs as well. Because statistically they say that in terms of healthcare cost, that roughly 10% of the population accounts for 80% of the healthcare cost.
Wow.
Because that 10% usually has one or more chronic conditions, they would call. So asthma, diabetes, heart failure, things of that nature. Every time a person has more than one, that would then exponentially increase the risks in terms of the type of treatment and the cost for drugs and treatment options. So the target really there is going to be, unfortunately, the Affordable Health Care Act doesn't necessarily drive down a lot of the costs as a whole, but it does make it more widely available for people that didn't have health care before.
How does ACA impact doctors out there and provide opportunities for entrepreneurs, for other individuals?
Well, that's a good question. That would be, and I wouldn't be speaking not for, on behalf of Kaiser, just in my personal opinion. And I would say that there are challenges, and what there are challenges, there are opportunities. So one of the first challenges that you would have is that you essentially have people that weren't insured before that are not going to get insured.
Right.
You have the same number of doctors
Right.
that's going to be taking on more patients. So it's going to take them a lot longer, so they're going to be strapped with that. Then you have more stricter regulations that they're going to have to adhere to as well. So I would presume then from a doctor's standpoint that it'll be a challenge for them to maintain the quality of care because you're going to be having the same amount of time, but you're taking on more patients with the same resources up against more strict regulations. That's going to be monitoring, making sure that you have certain type of procedures done according to the healthcare law. Now, in terms of that being the challenge, because you have a lot of people that you need to take care of, and that the industry as a whole needs to scale up to take on the wave of new people, not only those that are uninsured, that's getting insured now, but you have a next wave of baby boomers that are coming up as well, 69 million roughly. And so they say about 7,000 baby boomers turn 65 or older every single day. And so those people, because they're at a certain point, 65 and older, their healthcare needs are going to be accentuated quite a bit compared to someone who's a lot younger that way. So there's a greater need to take on those folks as well. So the opportunity there is, how can you come together with providing a solution that's going to be scalable to take on the large number of people that are coming up within the next 15 years and do that in a way that's cost effective. So in healthcare, they'd call that basically the triple aim, which is, one would be, how would you maintain patient safety to make sure that the patients are well taken care of with the medication and the treatment guidelines? Number two is, how do you maintain the quality of care? And number three is, how do you make it affordable? So providing a solution that can meet all three objectives is the big challenge for the healthcare industry as a whole. And technology is one way that might be an option for them to consider, because any company that were to help to maintain a lot of the data, help to simplify, to streamline the process, make things a lot more efficient and more cost effective, it could help to improve quality and save time, ultimately. So there's opportunities there from a technology standpoint, where if people develop certain kind of applications, smartphone applications, or maybe any kind of devices what they would be wearing on their wrist that can monitor their heart rate and their blood pressure, things of that nature, they can send that to a mainframe system that can give the care managers and the doctors and all that more of a greater timely awareness on how their patients are doing. So different companies out there that were to come up with concept and technology, innovation, there's a good chance there too where they can capitalize on making the healthcare system more efficient, more effective using technology.
I see. What does the international community see ACA as a, do they see it as a good thing or bad thing? What do you think?
I think they're probably still they're still waiting to see how things unfold. The ACA, otherwise known as the ObamaCare Act, is still very early. It first opened up, it signed March 23rd, 2010. Open enrollment started October 1st of this year. But really we won't see the effects until January 1st, 2014.
I see.
So while people enroll, we don't really quite know how things will unfold, hopefully for the better.
Right.
But I think that when you look at other countries, like in Korea, for instance, you have, when you go to Korea, if you're a citizen there, you can get pretty much government coverage.
Oh, okay.
The government takes care of you.
Oh, I'm moving to Korea then in that case.
So aside from the plastic surgery and everything else too,
Right.
people might want to just go down there to get good coverage. Over here, it's more government mandated. The government's really stepping up to play a greater role into providing more options in terms of healthcare plan to bring more people on board, bring in more of a consistent framework for people to select and choose what's healthcare plans. So in that sense, it's a good effort, but from an international community, depends on which country. I think it really has to give it some time before things unfold. Because they say that the cost involved expected would be roughly about $140 billion over the next 10 years as a result of the ObamaCare Act. And then the second 10 year, this is according to the senator from Wisconsin, Paul Ryan, he estimated roughly $1.3 trillion on the second 10 years as a result of Obamacare. So from that perspective, that may be more of as a way like other countries might see it, as more of saying, okay, this is great, a new law comes in place, more people get insurance, but it's going to really quite increase the cost as the whole from the United States. And so that might have what kind of impact that's going to have with the US dollar. Who knows?
What do you see as the future of healthcare industry?
Well, there's a lot of that's a great question. Well, I'd say that when you look at the movies, you see a lot of the different type of futuristic, the Iron Man's where you throw something on the screen, you start moving things around. But really what it's coming down to is personalized and customized medication and treatment options specific for that person based on their DNA and genes.
Oh, okay.
So it's not a particular pill, say Lipitor for, it's not that pill that everyone takes that has different type of reactions.
I see.
It's more medication that's personalized based on your blood type and your gene and everything else.
Oh, wow.
And so the idea there is really just so that's one aspect in terms of treatment options. And then secondly is giving people more of a big advantage of allowing them to maintain their own health in the form of a smartphone application or wearable devices that can monitor your devices, that can monitor your conditions, and that can report all that information at your fingertips.
I see. So, you know, 10, 20, 30 years down the road, I'll be looking at my own medical, not just electronic health record anymore. It's a customized personal profile on Wendy's health, from the way I walk to my heartbeat to the way I eat to my personalized medication. So I very much look forward to that. And thank you, Bryan, for being here today, for sharing with me your insight and your expertise.
My pleasure.
And for the audience watching, thank you so much for tuning in to The Healthier You with Wendy. Good night, everybody.